What's up guys, my name is Dr. Josh Jagoda. Today I'm going to show you how to do self-myofascial release so that you can help your knee pain. This is going to be particularly effective and helpful for those people who are having knee pain right around the front of the knee, the sides of the knee, and the kneecap. More particularly, it's going to really help with those people who've been diagnosed with chondromalacia patella, and that's really when the kneecap starts to lose some cartilage and starts to go closer and closer to the bone. First things first, you definitely want to work out some of the quad muscles and work through here, but I'm gonna show you a little bit of a technique that you can do to the kneecap itself. One thing you're going to want to use, and in this case I have a little bit of oil, but you can use some sort of lotion or anything like that. So what I'll start by doing is just placing a little bit of oil on the knee. Again, I will work my quad usually a little bit first hand, but just for this purpose, I'm going to show you. I'm going to work all the way around the knee, and I'm going to just take my fingers, and I'm going to dive just a little bit down, going all the way down. And you're not going that hard, and right here is that area where our quadricep tendon comes down and actually attaches. So we want to be really light. We don't want to go on the bone. And what you want to also do is, if you can, guys, maybe put a pillow underneath here. You really want your quad to be very, very relaxed, very passive. And this is really very nice and easy when somebody else is doing it for you. But if you see what I'm doing here is I'm coming around the side. So if you take this like kneecap like this, like as if it's a rock in the middle of a river, and then the river is going to flow down and then kind of go around like that, or if you from this angle, it's going to go like this. The river is going to go this way, and it goes around the rock. So what we're doing is going around the rock and following the rock along its edges and then coming back down. This feels really nice even when you are your own person just doing it. But I'll start up higher than the quad. I'll come in. I'll do several passes one direction, and then do the several passes on the other. Just going this way. Really nice and firm, but gentle. This feels really good, actually. So, and what you can do also is, if you have someone else, you can also start down at the bottom of the knee and then kind of pull upwards and then come around the rock, so to speak, again. Just coming all the way up. And then you can kind of take two fingers and guide them back around like this. You can also come back up, pulling around with your thumbs and then pulling the tissues upward. Really nice, really easy to do. If you want, you can bend the knee just a tad, and then what we can do is we can take our fingers and almost kind of like put this rock in the middle or patella, and we can kind of go side to side. We can push a little bit more and glide over the knee. And I'll tell you what I'm talking about in a second, because what I'm doing is I'm pushing as if, like, again, this is the rock and this is the river. We're going in this direction, and then we're going to go over the kneecap, right? And just keep that in mind, because I'm going to talk about something really important in a second. So when I go here, I have a little bit more pressure. When I come to this area, once I start getting over the rock or over the kneecap, I'm going to start letting my pressure up. So just from this angle, I'm going to give a little bit less pressure and let my hand glide a little bit. When somebody is having kneecap pain or chondromalacia patella, again, what's happening is that kneecap is coming closer and closer to the bone. And so what you really want to do is to avoid, and let me repeat that, you really, really want to avoid doing direct compression. So things like kneeling on your knee is going to push the kneecap into the bone. Pushing straight down is going to put the kneecap into the bone. And so when I come here, I'm pushing down and I'm letting some pressure go over and above that knee, releasing it, and then I'm coming back down a little bit more firmly. And likewise, if I'm coming this way, from this way or down to up, I'm going to take that pressure, I'm going to pull in, nice firm pressure, release some of that pressure, go nice and smooth over the top of that kneecap, and then once I fall off that knee, I can add more pressure into the muscle. And I really would like, if I started all the way up here again. Like I told you that I would work a little bit of the quad first if I can, but you can do the same thing just like this. Very gentle, guys, really nice and easy. Coming up. You don't have to meet the quad yet, but this might help it loosen up and relax, and really just make you feel more comfortable and just coming in all directions. When I do this type of technique, I like to kind of reinforce my thumb, so like one thumb is on top of the other. So this way I'm not kind of like jamming my thumb and hurting my thumb. I'm just kind of reinforcing it, keeping my thumbs nice and straight, and my hands are coming down. And that's the same thing that I'm going to be doing when I come to the sides here, or the sides here on each of side of the kneecap, just like that. And again, coming back up, and then finally maybe just relaxing the knee, mobilizing it, going in circles, side to side, up and down, in all different directions. So this is a great technique, guys. It feels really, really nice on the knee. It is great for kneecap pain. So this is how you could do some self-myofascial release to help your knee pain. All right, guys? My name is Dr. Josh Jagoda. Thanks for stopping by. Don't forget to subscribe to our channel. I'll see you guys for the next episode. Take care.